Hi, Paul Flackett, Good News Broadcast, speaking to Kathy Kastan. Hi, Kathy, how are you?
I'm doing great.
Congratulations to you. Actually, I met you at the Red Dress Awards ceremony here in New York, and you're from Memphis, is that right?
Yes, it is.
Because I have something that says, Memphis resident to receive Women's Day Award, and it was a great event. Heart disease survivor Kathy Kastan is the first patient advocate honored. Wow, congratulations.
Thank you.
What's a advocate, patient advocate?
I think it has multi-layers to it. I was a patient at 41 with bypass surgery, and ended up connecting with a number of advocacy organizations such as WomenHeart, the American Heart Association, and the National Heart Lung Blood Institute's Heart Truth campaign afterwards, because once I researched the information about heart disease in women, I decided that as a social worker and a natural, I think, born advocate, I needed to get involved to hopefully change the numbers of women who are affected and die from heart disease every year. And those groups are great venues for, to do just that.
It's in your blood to be to serve, right?
I think so. My father has always been an activist, and my mother as well, so I think it comes naturally.
And your family as well, your own family right now does.
Yes. We're a pretty service-oriented family.
Excellent. Now, you've also written a book, too, author from The Heart, A Women's Guide to Living Well with Heart Disease, and co-author of Women's Heart's All Heart Family Cookbook. So now, was that after your bypass?
Yes. What happened was I got involved with WomenHeart, the National Coalition for Women with Heart Disease. They have a science and leadership program every year. I was in the first program they had for 60 women who are selected across the country to come in and get trained how to do media work and community outreach and be public speakers. And so I went through that program, and then I started working, back in my own community in Memphis. And, the awareness at the time, which was in 2002, was pretty at an all-time low, that heart disease kills more women than men. It has since the 80s. So once I started saying numbers like that, I started piquing interest, and I started doing a lot of community work. And before I knew it, I was elected president of WomenHeart. And then that connected me to all these other groups, American Heart Association and the Heart Truth campaign. And through my travels over the years, I noticed consistently that there were a lot of issues for women and their families who had been diagnosed with heart disease or who had a heart attack or bypass, and a lot of it is psychosocial issues. And my background is I'm a psychotherapist, so naturally I decided that I needed to interview these women and see if there was any common denominators that kind of they experienced in their home lives and their work lives and being thrust into the healthcare system. And sure enough, there was a lot of commonalities. So I interviewed about a little over 100 women and their families to get the data. And then I did a lot of research, and that's where From the Heart came from. So it's really a guide to help women manage the health crisis that comes with being thrust in the healthcare system and having heart disease.
Let me, if you don't mind, let me go back a little bit to when you're 40, okay?
Okay.
A year or two before. You had a bypass surgery. So were you a regular, if you don't mind me asking these questions, did you go see a doctor each year?
Oh, yeah. I mean, I think part of my story is pretty dramatic, and that's probably why it piqued so many people's interest. At the age of 40, I started having symptoms with exercise. I'd have shortness of breath. I'd have a little pain down my left arm in my master's swim class. I'm average weight. Obviously, I was young. I don't smoke. I don't have high blood pressure. I have borderline cholesterol. The only thing in my family history was that my mother died of a massive heart attack at 61. But they never connected those dots because my mother had juvenile onset diabetes. So to make a long story short, after 8 months of symptoms and then finally ending up with these symptoms coming together, I went to a cardiologist who didn't do enough testing on me and misdiagnosed me with mitral valve prolapse. And then after that, a series of things happened in which I went, because I trusted this man, I went to the altitude, and these symptoms became classic Hollywood heart attack symptoms. again with exercise. And that's when I ended up going to a second cardiologist. And basically, it took him a while to figure out what was going on. And then every treatment and every procedure he did to my heart failed or caused complications over an 8-month period, which led to my emergency bypass surgery. And then after my surgery, I was still sick. In fact, I was more debilitated after surgery than I was before, and I couldn't walk from room to room without chronic chest pain. My 3 boys at the time were very young. It terrified them. My husband, who's a physician, and my father, who's a physician, well-connected academically, couldn't help me. And that's how I got to WomenHeart. And they're the first organization I ran into that exclusively deals with patients and who supports patients and their care of getting well and also in prevention. And they were there for me. And they were the ones who finally said, Kathy, you need to get another opinion. And then I went to a third cardiologist who finally figured out what was going on and put me on a different medication regimen. And within a few weeks, I got my life back. Started to feel well, and then in a few months, I got my life back. And that's how that's part of what I think gave me the passion to hopefully help other women to never have to endure what I went through and my family went through. And I've been doing it ever since. And I'm still on fire with this stuff.
Good.
It's just something I feel very passionate about. Sometimes my husbands wonder why I'm still, after 8 years, I'm still doing it. But there's still such a huge need. And the women, I still get calls and emails every day from people that I don't know who ask questions and want to know what they should do. And so I feel like it's a useful thing for me to be doing, and it's very fulfilling.
Well, let me ask you a couple of questions. Just mainly, I guess, because you come from a medical family, right?
Right.
And I might not know answers to these things, so they're sort of like simple questions. One is, there's this cholesterol count that people say under 200 is a good thing. And then there's these EKGs that people take and stress tests, right?
Right.
And so, like the years before, in the 30s and so on and so forth, did you take those kind of things, and was your cholesterol down? I'm saying this so other people can, consider, what they should be doing. What kind of more tests are there to do? What do they? Either arteries are blocked or they're not blocked, right? Is that right? I don't know if that's right.
Well, no, there's different levels of problems that could happen with your heart, and there's different types of heart disease you can have. I had something very specific called vasospasm.
Okay.
Which is not directly linked to necessarily plaque buildup in your vessels. They don't really understand it, in fact. But a lot of people, the classic coronary artery disease, of course, is plaquey buildup. And that's, what breaks off and can clot and kill you. In terms of cholesterol, yes. The one thing that we advocate as all these organizations advocate for is that women and men know their numbers and, know what their LDL is, which is, should be low for your total cholesterol, and know what your HDL is. But each one of us is different. So, because I'm a higher risk person, because I've had this bypass surgery in my 40s, the numbers that they want me at are going to be different than they may want you at. And so that's why it's important you communicate openly with your healthcare provider about your cholesterol numbers, about your blood pressure. You need to know your family history, whether your mother or your sister had some sort of coronary event before the age of 65 that puts you at risk, or if your father or brother had a coronary event before the age of 55 that puts you at risk. But you have to have the dialogue with your healthcare provider, again, because each one of us is different. And yes, when this first happened, the standards had just changed. The American Heart Association guidelines had just changed in terms of cholesterol. And yes, they generally will like patients under 200 total cholesterol. But it's just important to chat with your physician about that. And, another big thing is BMI, your body mass index, which is a huge issue for our country right now. As you know, Michelle Obama is on the warpath against childhood obesity for good reason, because we're now an epidemic. It's an epidemic situation nationally. The single most important thing people can do to reduce their risk factors is to cut out cigarette smoking. It's the single greatest cause for most of the healthcare problems in our country. And you're at 2 to 3 times increased risk of dying from coronary heart disease if you smoke. And what's amazing is if you cut it out, you reduce your risk significantly very quickly within a year. So there's a lot of reasons to know your numbers and communicate with your physician and be assertive about what it is you need to know about your risk factors so you can manage them, because obviously, like in my case, most of my issue is genetic. So I can't really control the fact that I have these genes, but what I can modify is my diet and my exercise and take prescribed medications, and that lowers my risk. And that's a constant, it's like anything else. When you know that this is something that's in the back of what's going on in your body, you've just got to pay attention to it and focus on it every day. And it's a work in progress. That's what I say.
Well, I'm personally on a statin to lower my cholesterol, and I'm calling it almost and I take an aspirin, and those are the two things I do. And to me, it's like a wonder medicine. My cholesterol was like 240 or something, 230s and 40s always, and ever since I've taken this, I'm down in the 80s or so.
Right, which is great, and that's right.
And that's good news.
It's excellent news. But see, people have this perception of taking medication that it's quote unquote bad, and I think they need to get out of that mindset, because the reality is these medications save lives. And the things that the way that they work on our bodies and our physiology is remarkable. And that 10 years ago, I probably would be even more of a walking time bomb than I am today because of statins and because of aspirin. I think we just all have to advocate with our physicians that this is an issue and this is something we want to work on, and what can we do, and how do we get our weight down, and how do we increase our exercise in a healthy way, and is it okay, and talk about what kind of medications are the best for you. And that's the other thing. There's not just one statin. There's
all kinds.
Many
yeah. I switched. I went from one to another one.
Yeah, and you just have to talk, because sometimes some of them do have side effects, so you have to talk about that with your health.
I had a pain in my arm. I told my doctor, and he took me off the one that I had and gave me another one, and knock wood, ever since then, I've felt good, and I feel a little more protected, let's put it that way.
Well, exactly. Now, a lot of people I talk to will say, well, I'm on a statin so I can eat anything I want. That's not the reason the statins exist. You really are still supposed to have a diet and high fiber, including vegetables and fruits, and eating a healthy diet, and drinking lots of water, and making sure you stay hydrated, and just taking good care of your body. I mean, your body is, like anything else. If you put in good fuel, it's going to respond positively. So I think it's important to continually give ourselves a premium gasoline, I guess, as much as we possibly can.
The good news is that we were created so unbelievably, phenomenally, that we should do our best to take care of this miracle.
Exactly. I mean, I always think about, do I really is this something I really have to have right now? Can I put this off? And, you have to make choices, and, you can't live in a vacuum, but at the same time, it's just making choices, okay? I always recommend to people moderation is the key to living positively. And that means that once in a while, you'll have, a piece of, steak. Maybe you'll make it tenderloin so it's the least fatty steak. But, other times you'll make sure that you eat fish. And, you just make those choices, and you stop using, I'm in the South, so people cook with lard here still. And they fry everything. And, we're in the stroke belt. So, it's a very hard thing as a California girl to come here and try to get people to understand that healthy foods can actually be, you can pan fry them in olive oil and they will taste just as good, if not even better, than frying them in lard.
There you go. Last question. What's good news for you, Kathy?
Being alive and enjoying the spring and having a wonderful family.
Okay. Sounds beautiful to me. Thank you so much for sharing your good news with us.
Thank you.
Take care.
All right, you too.
See you soon. Bye-bye.
All right, bye.